What is normal WBC count range in adult? A. 2000 to 4000 cubic millimeter. B. 4000 to 10,000 cubic millimeter. C. 7,000 to 20,000 cubic millimeter. D. 10,000 to 25,000 cubic millimeter of blood. And the correct answer is B. 4,000 to 10,000 cubic millimeter of the blood. The white blood cells count is used to detect an infection or inflammatory process and other diseases that affect the number of WBCs such as allergies, leukemia and immune disorders. Most important preparation before taking oral temperature includes A. Make sure that patient perform oral hygiene before the procedure. B. Make sure that patient has not taken any cold and hot 10 to 20 minutes before procedure. C. Make sure that patient is not wearing any dentures while performing the procedure. D. All of the above. And the correct answer is B. Make sure that patient has not taken any cold and hot 10 to 20 minutes before procedure. The patient should not have recently smoked or ingested cold or hot drinks or food because it affects the accuracy of temperature measurement. When helping a stroke patient, nurse should assist A. From behind. B. On weak side. C. On strong side. D. From back. And the correct answer is B. On weak side. Ensure that weak side of the patient is well supported when taking care. To prevent injury, do not let the arm drop when patient moves. Place a pillow under the weaker side to support it. Keep the weaker leg or arm in natural position. Which of the following is leading cause of death among adolescents? A. Stress related illness. B. Suicide. C. Communicable diseases. D. Accidents. And the correct answer is D. Accidents. To protect yourself while driving, wear your seat belts, drive defensively and avoid risky behavior that may lead to accident. Movement of body part towards body's midline is termed as A. Abduction. B. Adduction. C. Extension. D. Pronation. And the correct answer is B. Abduction. Abduction is the movement of limb away from the midline of the body. Adduction is the movement of body part towards the midline of the body. Extension is an unbending movement around joints and limbs. Pronation is rotation of a forearm and hands. What is the formula to calculate BMI? A. BMI is equal to weight in kg by height in centimeter square. B. BMI is equal to weight in kg by height in meter square. C. BMI is equal to weight in pounds by height in meter square. D. BMI is equal to weight in pounds by height in centimeter square. And the correct answer is B. BMI is equal to weight in kg by height in meter square. BMI stands for Body Mass Index. It is useful measure of overweight and obesity. It is calculated from your height and weight. The higher your BMI, the higher your risk of certain diseases such as heart disease, high blood pressure, type 2 diabetes, gallstones, breathing problems and certain cancers. What position is given to the patient while insertion gavage tube? A. Knee chest position. B. Supine position. C. Mid Fowler position. D. High Fowler positions. And the correct answer is D. High Fowler's position. Position the patient sitting up at 45 to 90 degree angle. This allows the NG tube to pass more easily through the nasopharynx and into the stomach. Subcutaneous injection is given at the angle of A. 15 degree, B. 30 degree, C. 45 degree, D. 90 degree. And the correct answer is C. 45 degree. Anthelmintic enema is given to A. Soften hard fecal matter, D. Destroy intestinal parasites, C. Remove flatus, D. Remove foreign particles from large intestine. And the correct answer is B. Destroy intestinal parasites. Anthelmintic enema is given to destroy and expel the worms from the intestine. Cleansing enema must be given prior to anthelmintic enema so that the drug can come in direct contact with the worms. Which of the following is considered as primary prevention strategy? A. Early identification, B. Reduction of disability, C. Control of spread of disease, D. Early treatment of disease. And the correct answer is C. Control of spread of disease. Types of preventive stages are primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Example of primordial prevention is sanitization. Example of primary prevention is immunization. Example of secondary prevention is pap smear aimed to diagnose cervical cancer. Example of tertiary prevention is rehabilitation efforts. What is the primary source of heat in the body? A. Sunlight, B. Metabolism, C. Heartbeat, D. Circulation. And the correct answer is B. Metabolism. The major sources of heat is metabolism apart from the other minor sources. In metabolism, the heat is released in the form of chemical reactions and also in the form of cellular respiration. When assessing blood pressure, sounds that is heard through a stethoscope placed over the artery is termed as A. Crackle sounds, B. Corotcope sounds, C. Brachial sounds, D. Murmur sounds. And the correct answer is B. Corotcope sounds. How much sodium contains isotonic normal saline per 100 ml? A. 0.09%, B. 0.9%, C. 9.0%, D. 0.45%. And the correct answer is B. 0.9%.